Hello everyone, this is Chadi Alraies from NCVH 2023 in New Orleans. I'm really privileged today to be with Dr. Bob Foster to talk about a very important topic that majority of the interventional cardiologists are aware of it, but they ignore it.
Right.
Thanks for being with us, Dr. Foster.
Well, thank you. And it's one of the things I ignored for many years and just thought that, to do what we had to do interventional cardiology and do peripheral work, you just had to put on your lead apron and go after it, you and your team. And what we're finding is that many of us are beginning to have low back issues, spine issues, knee issues, but also the effects of the radiation. And the amount of radiation, the amount of lead protection that you can wear, really to be protected, your body to be protected, you have to wear the heavy lead. The light lead just doesn't quite do it. But wearing heavy lead has its issues with your spine. And so for me, after 2 back surgeries, it was one of those situations where, number one, I wanted to begin to educate people that there's got to be a way to be in these situations, be in that environment, and get you and your team out of the lead apron.
And as you said, Dr. Foster, is a problem that we are aware of. We know it's existing, but I think it's the drive to do the procedure, make you ignore it till one day you wake up with back pain.
And our passion is to take care of patients, and that's what we've done for so many years.
Correct.
That's what we want to do. That's what we were trained to do. That's what our passion is. But we're doing it at the expense of our own bodies.
Absolutely.
And so now there are newer technologies out there that allow you to be able to do this in a safer environment.
Absolutely.
And hopefully get you and your team out of lead, because the most experienced operators are the ones hurting.
Yes.
And we still don't know the effects of all the radiation that we've got, and that stochastic effect. So we don't really know when that's going to occur.
Doesn't go away.
Yeah. And
so that's driving
for
for something else. So you are an innovator. You are drove your innovation based on your personal experience. So tell us about it.
It was, I ruptured a disc in my back to the point that my leg was paralyzed. I had to come out of the cath lab for almost a year, and that was the worst thing for an interventionalist who all of a sudden becomes a clinic doctor. It's very, very tough. So I wanted to be back in. And so in going back in, I had to look for a solution. And so we designed the Rampart, which allows you to be in the cath lab. It's got a millimeter lead protection between you and the source. It allows you and your team to come out of their lead aprons, and you get 99% total body protection. So it allows you to, number one, safely wear your badge, because all the data shows that about 60% of people, only about 60% wear their badges because they're afraid that they're going to get too much radiation and be pulled out of the lab. So we've got to have better protection. We've got to have better education, because I think one of the things is our teams don't understand it. We need to keep the best hands, the best teams operating.
Yeah.
And when you lose those really experienced people, I think patients suffer.
Exactly. So they lose the experience. And as you spoke earlier, it's very important, not just for cardiologists, but the staff as well, the nurses and techs with you, that I think get more exposure than us.
Yep.
And the fellows for sure.
And it's converting that knowledge not only to the operators, but also to the hospital and the hospital system to say, the lead apron's been around 100 years. But it's not quite good enough. It only protects about 60% of your body. There are parts of your body that aren't protected by the lead apron. And so we really need to convince them that these newer technologies are out there. We have a new generation of protection, and we need to look into those to get our teams protected.
But Bob, one of the challenges I have is now to convince administration to purchase these systems. I don't think they still get it yet, the importance of this protection. So how we can address that to them?
Yeah, I think a couple of ways. There have actually been some pretty good studies showing that if you lose a physician, that it costs about $1 million to the hospital to bring another physician kind of back up. If you lose a tech, it's about $60,000 to $100,000 to bring another tech up, because if they have to leave due to their back issues. So there are consequences. You also want to have staff retention, who we start having back problems, they start leaving and going into other subspecialties. So your most talented people, and then you have to go through the whole retraining process. So if you look at staff retention, at employee protection, I think your human resources are your most valuable thing to the hospital.
Yes.
You want to keep those operators in your hospital.
Right.
And the only way to do that really is to keep them comfortable while they're doing their job, and they'll perform better.
Right. And do we have the Rampart here on NCVH?
We do.
Yeah. So for the people out there, so next time in NCVH, the booth will be there to try it as well. Again, it's 99% protection. You can take off your lead with the badge on, just to make sure you are capturing that. And the physical burden is out.
That's it.
Yeah, and the patient is for sure, taken care of in timely fashion.
Exactly.
Well, thank you so much, Dr. Foster, for your time and for your innovation. And sorry for your personal experience.
Thank you,
yeah, hopefully you get recovered soon. And please watch these videos and others on NCVH YouTube channel. This is Chadi Alraies from New Orleans. Dr. Foster, thanks again.
Great, thanks so much.
Thank you.
All right.